So next we'll move on to neurodegenerative disorders. So neurodegenerative disorders, we have various diseases. These neurodegenerative disorders are going to be very important due to the inclusions present in these neurodegenerative disorders, and also due to the genetics which is involved here. Okay, so we'll start with Alzheimer's disease. Alzheimer's, we have also seen in many movies also. It is the most common cause of dementia. So very commonly, dementia is caused by Alzheimer's disease, wherein the patient forgets everything. So memory will be lost, and they'll not have a spatial orientation with time, and they'll not know the close immediate family also. This kind of memory loss is going to be there with the cognitive impairment. So usually it is sporadic, but sometimes it can have a familial association, especially with Down syndrome. So Down syndrome, normally when Alzheimer's is usually associated with senile people. So or with elderly age group only, the patients start developing this dementia. But in Down syndrome, this dementia starts appearing before 40 years of age. Why? Because there is going to be it is related to the pathogenesis. Let me tell that in a while. So, in familial causes of Alzheimer's, there is also other mutated genes like presenilin 1 and 2. So, presenilin 1 and 2 genes can be mutated. Other than that, apolipoprotein E epsilon 4. So, this also can be mutated in familial causes of Alzheimer's disease. So, what happens actually in Alzheimer's disease is that there is going to be a protein called as amyloid precursor protein. So, APP protein, its location is present on the chromosome 21. So, we all know chromosome 21 trisomy is going to happen in Down syndrome. So, this amyloid precursor protein is going to be present in an extra number, right? So, rather than normal people, they are going to be present in extra number, and that is why Down syndrome people are much more prone for getting Alzheimer's disease at an younger age. Okay, remember that. So, what is the actual pathogenesis happening with this APP protein in Alzheimer's? Basically, there is this APP protein is a transmembrane protein. So, it will span the extracellular area and the intracellular area also. So, this APP protein is normally cleaved by two enzymes, which is alpha secretase and gamma secretase. So, when this alpha secretase and gamma secretase cleaves this APP protein, it is going to be broken down into smaller pieces which are soluble and lost. And that is the normal thing. But when there is a beta and gamma secretase, so when beta and gamma secretase enzymes are active rather than the alpha secretase, so this beta and gamma secretase activity will lead to the formation of A beta. So one of the subunits will be A beta, and these A beta monomers are not easily degradable. They are resistant. So what happens is these A beta monomers will start forming oligomers, and then they will polymerize into polymers also. So they will start forming aggregates. So these aggregates are the ones which are called as A beta. Okay, and these A beta aggregates are usually of the type A beta and A beta 40 and A beta 42, out of which A beta 42 is much more common. And these are the ones which are forming the neuritic plaques. Okay, A beta 42 is the component of the neuritic plaques which we see in Alzheimer's disease. Then what happens is this A beta which had accumulated, it is going to accumulate. So it is not being degraded. So any kind of accumulation, it is an accumulation. So it is going to damage the neurons, and especially the Meyer-Net nucleus. So Meyer-Net nucleus is responsible for production of acetylcholine. So without Meyer-Net nucleus is being damaged and deposited with these intracellular accumulations, it is going to cause decreased production of acetylcholine, and that will eventually lead to dementia in the patients. So grossly, how does the brain look in an Alzheimer's patient? Suppose this left image is the normal brain, which we have the normal sulci and gyri, but compared to that, the right image, if you see here, the brain is kind of shrunken, and also there is going to be widening of the sulci. So these are all the sulci, these are all widened here. Okay, compared to the normal brain, look at the sulci here, it is quite thin, right? So here it is quite widened, and the gyri, which are the elevated part, are all thinned out. So thin, narrow gyri and widened sulci are features of Alzheimer's disease. And to compensate for this loss of brain parenchyma, there is going to be hydrocephalus. So lots of hydrocephalus X going to happen, and that is called as hydrocephalus ex vacuo. So as a compensatory phenomena, it happens. So the classical microscopic image of Alzheimer's disease will be the formation of neuritic plaques and neurofibrillary tangles. So neuritic plaque, I already mentioned, it is going to be composed of that A beta 42 aggregates, right? So neuritic plaques, they have the central amyloid core, which is composed of this A beta 42, surrounding which we are going to have this dendrites or neurites. So dystrophic neurites are going to be present. So this is the appearance of a neuritic plaque. So in this image, if you see, it is given a special stain called as Bielczowski silver stain. So Bielczowski silver stains are used to highlight these neuritic plaque and neurofibrillary tangles. So in this, the center is appearing kind of dark, and surrounding which again it's having a darker area. So all of this is highlighting the A beta 42. Then the next image is that of a neurofibrillary tangle. So neurofibrillary tangle is usually composed of neurofilament and a tau protein. So neurofilament is an intermediate filament. We all know that, right? So it is an intermediate filament. It is attached with the tau protein, and this forms the neurofibrillary tangle, which has a characteristic flame shaped appearance. So this flame shape is again highlighted by the silver stain, Bielczowski stain. This is the HND stain, and previous image was this is the silver stain, and this is the HND image. Here you can appreciate that it is having this flame shaped appearance. Okay. Then we can also see Hirano bodies. Hirano bodies are composed of actin. So actin is the composition of Hirano bodies, and these are nothing but eosinophilic rod shaped structures. So can you appreciate there is a rod shaped structure here? So eosinophilic rod like in cytoplasmic structures, which are called as Hirano bodies, seen in Alzheimer's. Also, we can have cerebral amyloid angiopathy. So Alzheimer's was related to this amyloidogenic pathway, right? So this amyloid A beta 42, which is formed, it can also deposit around the vessels, because amyloid usually tends to deposit around the perivascular spaces first. So it is deposited on the vessel wall, and that is what is called as CAA or cerebral amyloid angiopathy. Even though it is not a specific finding, it can be seen in this. And if you use any immunohistochemistry for this amyloid, you can highlight this. Okay, the second image, which is showing this brown color, is being highlighted by the A beta IHC. Then moving on to the next neurodegenerative disease, which is Pick's disease. So Pick's disease is a frontotemporal dementia. So specifically, it affects the frontal and the temporal regions. And here the mutation is going to affect the MAPT gene. So MAPT is for microtubule associated protein tau. Okay, so tau is going to be mutated again here, and here the classical feature will be in the frontotemporal region. You can have the gyri, which are very thin. So rather than being bulging, this gyri is going to be very thin, and the sulci are quite widened. So if you see this sulci here, this sulci is quite wide, and this is the gyri, which is very thin, like a paper or a knife edge. So it is called as a knife edge appearance or a walnut brain kind of appearance. Okay. In Pick's disease, we can also see inclusions here. So in the neurons are going to be enlarged, and inside the cytoplasm, we can have certain inclusions, which are called as Pick's body. So Pick's body is composed of tau protein. So mutation was tau, right? So tau protein inclusions are present inside this neurons. So in this image, if you see, this is the cytoplasmic, this entire thing is the neuron, and here you are going to see this inclusion. So this is called as the Pick's body. Then third disease will be Parkinson's disease. We are all quite familiar with Parkinson's disease, definitely. So here there is going to be deficiency of the dopaminergic neurons present in the basal ganglia. So where in the basal ganglia? Specifically in the substantia nigra and locus coeruleus. So here the dopaminergic neurons which contain the neuromelanin is going to be deficient. So it can have various kinds of mutations, which can be autosomal dominant or autosomal recessive. And the major pathway involved here will be impaired mitophagy or autophagy. So one of the types of autophagy is mitophagy, wherein mitochondrial autophagy is going to be defective. So impaired mitophagy and impaired autophagy forms the pathogenesis for Parkinson's disease. So you need not remember all of these genes, but just remember PINK1 and Parkin gene. So PINK1 and Parkin gene were involved in the impaired mitophagy related to Parkinson's disease. Okay, PARK for PARK, you can remember. Then clinical features, the patient will be having decreased facial expression. So he will it will appear like that he has put on a mask. So mask like faces along with a stooped kind of a posture, and the patient will walk with very short shuffling gait. So that is called as a Festinian gait, and they'll have rigidity in their movement. So rigidity will be there, and pill rolling tremors, and also their general movements will also be quite slow. So these are all features of Parkinson's disease. So if you see, dopaminergic neurons are deficient, right? So grossly also in the brain, you can appreciate that there is going to be a pallor in the substantia nigra area. So compared to the right image, which is the normal area, so neuromelanin is present, which is giving that black color. This area is a substantia nigra, which is appearing black color normally. But here in this, if you see Parkinson's disease, because of the deficiency of these dopaminergic neurons, there is going to be pallor rather than the black color. And the classical inclusion which we see in Parkinson's disease is, yes, Lewy body. So Lewy bodies are present in Parkinson's disease, which are composed of this alpha synuclein. So alpha synuclein, their classical appearance is going to be that of a intracytoplasmic inclusion, which has a dense center with the peri-inclusion halo. So around the inclusion, you are going to have a halo. So in here, if you appreciate, this is the darker part here, and surrounding that, you are having this halo. And this is the neuromelanin present inside the dopaminergic neuron. That is why it is appearing brownish black in color. Okay. So this classical peri-inclusion halo is characteristic for a Lewy body, which is composed of alpha synuclein, and it is present in Parkinson's disease.